I hate to interrupt the music. Hope it won't be better than the speech. First, I want to thank Joe for inviting me and for being such a good partner at the Clinton Global Initiative. I want to thank he and his clinical partner, Dr. Peter Pronovost, for putting this amazing summit on. And I want to thank all of you who have come. Some of you have come from a very long way away indeed to talk about patient safety, science, and technology. I try very hard to know what I'm talking about when I show up at a meeting. I spend an hour a day studying the global economy every day, still today. But I feel here I should be there and the rest of you should be up here because I never learn anything when I'm talking. But I do want to say a few things about what you're doing in the context of how I see the world today and the work that I do, because I think it is profoundly important. The modern world has a lot of joys, has a lot of benefits, has a lot of amazing things, as I see all of you working on your gadgets out there. And I was just up in Cupertino. I did a tour of Apple, and they gave me the new mini iPad. And my nephew begged me to give it to him, so I did. And I'm sure he'll make better use of it. But as we all know, there are a lot of challenges in the world we live in, along with all the assets. The world is still far too unequal in terms of access to health care and education and capital to start a job, a business, or even getting a job. It is highly unstable because problems from epidemics to terrorism to the financial crisis can cross national borders in a nanosecond. And it's not sustainable because the climate is changing. I woke up this morning in Los Angeles on the coldest day in 22 years. And I always complain because this is really a lousy time of year where Hillary and I live in Chappaqua, New York. It's dark and rainy and cold, and yeah, it was 16 degrees warmer in Chappaqua this morning when I got up. And my neighbors joke that the only gift I can give them is to continue to travel the world, because whenever I leave, the sun comes out. And so I wrote this little text message to Hillary this morning, and she said, well, she's in Washington. She said, at least it's rainy here, so if the sun's out, don't complain. The world, therefore, it seems to me, no matter what you do, your mission in life should be some variation of trying to build up the positive and reduce the negative forces that are binding the world together closer and closer all the time. Interdependence is our fate. Divorce is not an option. We cannot get away from the fact that what we do affects other people and what they do affects us. And I think we'd be far better off if we were shooting for a world of shared opportunities and shared responsibilities and a shared sense of community that enables us to reach across our differences. I noticed just in the photo line, you know, we had people there whose roots are in 4 or 5 different continents with different religious affiliations of all different backgrounds and probably dramatically different politics. When the human genome was sequenced and people began to, if you're an American, I spent a lot of your tax money on that. and it was worth every penny. So the first print cost us $3 billion. But now, as a result of what's happened since, just in children's health, I was at the St. Jude Medical Center the other day, and they were having trouble treating a rare form of brain cancer in children because the FDA had approved a drug to treat it, and it was 100% effective, except when it was 100% fatal. And because of the genome studies that had been done since, they discovered that miraculously, if you cut the prescribed dosage in half, it would have a 100% cure rate on the ones who were dying. But if you only gave half to the ones who were surviving, it wouldn't work. So it's an interesting time. But I worry because the world still has too many people with too much influence who believe that progress is a zero-sum game. Now, we Americans, we love zero-sum games. That's why we require football teams and basketball teams to play overtimes. And in college, they have to play till they drop. I'm a native of Arkansas. We once played Kentucky and beat them 71-63 in the longest football game in American history. I thought, what are they going to do when they carry them off in stretchers and there aren't 11 people on the side? It's fun if it's just a competition. But it's a lousy way to run a country and a lousy way to organize the world now. We need to look for more non-zero-sum solutions where we all benefit from both competition and cooperation. And in the world we live in, the most successful models of that are networks. Like you're creating a network. You show up next year, and by the way, I hope I can come be with you again just to see what you've done. You created a network, and networks can change the world. You heard Joe in the introduction say that the Clinton Global Initiative has now raised commitments worth over $70 billion that have affected in some positive way nearly 400 million people in more than 180 countries. It didn't start out that way. I just was tired of going to meetings where people talked about what they were going to do and never made a commitment to do anything. Turned out, and I made a bet that the people who were going to the meetings were tired of going to such meetings. And it was a fool's errand, so I invited people to actually pay a registration fee to come to New York at the opening of the United Nations when the security is tight and the president shows up and the whole town is frozen, to navigate all that traffic, to come and meet with political leaders, philanthropists, business leaders, and non-governmental leaders from all around the world in poor countries that we flew in to participate. And the only way they could come back the next year is if they made a commitment to actually do something. And 8 years later, we have now a full-time commitment office that works with people all year long to help them develop and keep their commitments. We have to have a mid-year meeting, which we're going to have next month in February. One of the people in the audience told me she would be there. We have a meeting for university students, and until the American economy has recovered, we'll continue to have one specifically for the United States focused on economic issues in the summer in Chicago. And all of a sudden, all this happened. I didn't do anything except that I show up when someone says, your foundation, which is totally separate from this, does something and we need your help. Will you work with us? I never attempt to raise any money from them or do any of that. We just created a network, and I wanted to see what would happen. And it grew like Topsy. And if I had brought in any management consultant, they would say, well, you know, it's not organized in this way, that way, the other way, and they'd be absolutely right. They'd say, you know, it didn't make sense. In 8 years, you've had these 5 commitments, and they were off message and didn't work as well, and they'd be absolutely right. All I know is that the cumulative impact of people working together, thinking together, talking together, reaching across the lines of knowledge, experience, and everything else that divides us has made a big difference. And that's what I hope you will do. Networks of creative cooperation will dominate the 21st century, for good or ill. And so I was thinking about that in the context of this whole issue of patient safety. I spend most of my time working in really poor places. I just spent a very long day in Haiti before I flew out here on Sunday. And in Haiti, just for example, the per capita income was for 75% of the people was less than $2 a day before the earthquake. So when I saw all these hand-wringing articles about how little progress had been made since the earthquake, I thought, you ought to come down there and try it. Because, in fact, an enormous amount of progress has been made if you count not the ideal outcome, but where they started, what their resources were, and what their organizational capacities were. So in really poor places, you find people that are just as smart as we are, many of whom work harder than we do just to keep body and soul together, but they don't have the structures, the organizations, or the networks that we take for granted. I mean, think how shocked you would be if the screens went dark, the microphone failed, the lights went out, and the air conditioning went off. Today it might be a blessing, but you get it. If you get bored with what I'm saying, you can excuse yourself and go drink a glass of water or go to the restroom. I spent a lot of my life in places where none of those options are available, or at least not with any certainty. In a stunning metaphor of the challenges of the modern world, the microphone failed while the president of Haiti was giving his inaugural address. But they're just as smart as we are. So where I do that work, we try to build systems and networks and maximize the use of modern technology to leapfrog some of the institutional and organizational steps that previous countries have made. Joe mentioned he went on this trip to Africa. He made two very important commitments coming out of that. One was to help a group that we work with called Building Tomorrow. It's an amazing group who figured out that they could help Uganda, the second fastest growing country in the world, which alas has an average of 7 children a family. And they can't possibly support that, but the only way that lowers the birth rate without regard to religion or culture is to put all the kids, especially the girls, in school and give young women access to the labor market. So this group figured out they could build a school with people in every village with an architectural design that was superior to the one the government was using if they just raised the money and built it. And that every time they built a school, they would save the government $200,000, which they could then use to go out and hire and train teachers. So we visited one of these villages, and I'm sure he would tell you the same thing. There were 2 of the teachers in the classrooms we visited. I would have been thrilled to have teaching my daughter in elementary school. And the other thing he did a healthcare-related commitment, which he's carrying out for women and girls, and I really appreciate it. But without exception, we're trying to build something that wasn't there before. Often, whenever we can, using technology. I'll give you a couple of things that don't have anything directly to do with health. After the tsunami in South Asia, a lot of the fishermen who survived wanted to go back to the sea. So we replaced their boats. A lot of the fishermen who were killed had widows who survived, and they wanted to go to sea, or their children did. We gave them boats. But this time, we gave them all cell phones. And they could all check the price of fish for 30 miles up and down the coast. The average fisher increased income by 30% because we brought basic information sharing across a distance too great for people to physically travel. In Haiti, one of the problems the country has had is it's been dominated for too long by essentially oligarchic families. And the banks, for example, had no small business services. The average bank was charging 45 to 60% for a small business loan. Needless to say, in a poor country, not many people got them. The reason is 20% of the country's income every year was paid in remittances by people working in America and elsewhere and sending the money home, and they earned a nice fee just flipping the foreign currency into local gourds. So why worry about having to do all the due diligence to decide whether this or that person was worth a small business loan? So former President Bush and I set up a fund, and we helped to fund the state's first small business loan program. And then we helped to fund the country's first mortgage program. Whenever I go to Haiti with someone who's never been there before, they said, "Oh, it's so tragic. All these houses have been abandoned." I said, "No, they haven't. They're being built a brick at a time." And a lot of times it takes these people 15 or 20 years to finish a house because they have no mortgage system. Just the reverse of what got us in trouble, right? We had too much of what they have none of. So anyway, the idea of consumer banking was laughable. Only 10% of Haitians had a bank account that offered anything like the consumer banking services you took for granted. But more than 80% of them had a cell phone. So we got the biggest cell phone company headed by an Irishman named Dennis O'Brien, Digicel, who's the head of our working group at the Global Initiative on Haiti, to partner with a Canadian bank, Scotiabank, to offer basic banking on the cell phone. Fund transfers, you can get your account balances, all the basic stuff consumers need. And all of a sudden, poof, any Haitian with enough money to have it in a bank now has banking services through a cell phone. Now, if you look at already advanced countries, we have the opposite problem, which you see in all these fights that are being carried out in Washington today, interestingly enough. We have the reverse problem of really poor countries. They have to build systems and networks. They don't have them. We got them. That's how we all got in these chairs today, right? I mean, I presume none of you was born in a log cabin you built yourself. We have them. And we worked, and we were rewarded, and we wended our way through life, and here we all are. But since the Sumerians, more than 6,000 years ago, every great society reaches a point where its institutions become ossified and rigid, where the people running them are more concerned about holding on to their present gains than creating a brighter future for kids, where position is more important than purpose, or where people are just so overwhelmed by complexity because over time you lap this solution onto that solution on the other solution, and all of a sudden every solution's got a constituency and nobody can reimagine a totally different way of doing things. In other words, there need be no evildoers in this story. It is human nature, and it is the nature of human development. But that's essentially where we are in America with a lot of things, including our investment strategy, including our regulatory strategy for the economy, including the way we do our budget, including the way we have planned or not for the retirement of the baby boomers, including the, I think, scandalous way we have set up a set of circumstances to avoid doing what is plainly necessary to mitigate the worst consequences of climate change, which all our neighbors in New York are now dealing with if they lived in the wake of the Storm Sandy. And that's a lot of what has gripped the healthcare system, where we now spend almost 18% of GDP on healthcare, and no other wealthy country is higher than 12. The Dutch are about at 12. And it's very interesting. The Netherlands has an entirely private system, and people just buy private health insurance, but unlike our, and then they just give a subsidy to people who can't afford it. So at least it's cleaner than the overlapping system we have. But unlike us, they have a budget, and they stick to it. And they seem to be pretty healthy. I think they're now the tallest people in the world. I think they have now displaced the Montenegrins as the tallest people in the world. The Germans and the French, who generally get the highest overall marks for outcomes and have a mixed system but a budget, are at about 11.8% of GDP. The Swiss are pretty high, largely because it's a small but highly mountainous country with a lot of people. The delivery costs are high. They live in mountainous, remote villages. But nobody's even close to where we are. We spend, translated into our dollars, between $850 billion and $1 trillion more a year for healthcare than we would spend if we had any other country's system. And this is before the implementation of the new healthcare law. And they cover everybody, and we left a lot out, about 16%. And the main drivers seem to be the way we finance healthcare, the way we charge for healthcare, lifestyle decisions that Americans have made, often with help from the way the food distribution system is organized, and the failure to continuously improve the system to prevent not only premature deaths, of which you say there are about 200,000 now, but also other health problems that aren't lethal, but are still exceedingly expensive and painful, undermining the productivity of the country. So what you're doing is really, really important. I've tried to, because I'm not a physician, I've tried to focus my efforts on what we could do to change the way we live, work, exercise, and eat. And I began with an effort to combat childhood obesity, which I thought was quite important. And we started with a radical proposition. I read one day, we started doing this after my heart surgery. The American Heart Association asked me to do something. I said, okay, but I'm not interested in doing PSAs and raising money. I'll raise money for you, but only if we're doing something that will change people's lives. And the number one public health problem right now is all these kids that have already caused type 2 diabetes to lose its former designation as adult onset diabetes. Just since I've been working on this problem, we've had several kids in New York and Washington who were 9 years old diagnosed with type 2 diabetes that they got from living the way they lived and eating the way they ate. So anyway, we set to work. And I decided to see whether we could create networks that people had been laboring in these vineyards for years thought we couldn't. For example, based on the experience I'd had with our foundation's Health Access Initiative, and Joe kindly talked about that, he gave me a little too much credit. Actually, there are about 8 million people in poor countries in the world getting AIDS medicine to stay alive, and 4.5 million get them off contracts we negotiated. But it became possible because I went to the major generic producers, mostly Indian companies, one big one in South Africa, and I said, you guys have got a terrible business strategy. You have a low volume, high profit margin, uncertain payment business. There were only 200,000 people in poor countries in the world getting this medicine. And one of them is no longer poor, Brazil. 2/3 of the people were living in Brazil, where the government had a pharmaceutical industry and could afford to pay to give the medicine to people. And I said, we're never going to get anywhere this way. Remember, this is before the Global Fund on AIDS, TB, and Malaria was set up. This was before there was any money from the PEPFAR program that President Bush started. And I said, you realize you're running a global health epidemic as if you were managing a small-town jewelry store. And they said, what do you mean? I said, well, you know, if you run a small-town jewelry store, one of my best friends ran one when I was a kid growing up, and I always brought my Mother's Day presents there. And he knew that none of the kids in town had any money, so he had to sell things that cost $1 or $2. But he also had really nice diamond rings for engagement rings and watches. And I said, so what do? You got to keep a huge inventory, and you have to have a big markup because you're only going to sell a relatively few items. And the payment's not entirely certain. I mean, somebody might have to bring the engagement ring back. That's your business model. And thank God I had a good relationship with India at the time. And so they knew I was foreign. I said, here's the deal. We need a grocery store model. Massive volumes, low profit margin, absolutely certain payment. And I said, I give you my word, if you don't make more money doing it this way, I'll rewrite the contract. I said, I promise you, you have to make money out of this or we'll never survive. And thank goodness they believed us and they trusted us. And I had a wonderful man-hour magaziner helping me who had done a lot of work with me on internet commerce and had made a lot of money, mostly in Northern Europe, on business consulting. And we started. And pretty soon the price went from, the generic price went $500 a year to $190 to $160 to $130 to $90. Children's drugs went from $600 all the way down to $60 a year. And then we started trying to do this with malaria drugs, thanks to the Gates Foundation. Much harder with malaria because the only drugs that work are based on artemisinin. And they're inherently much more expensive. So they have to have a subsidy. Then we started working with maternal and child health because there is medicine that's 98% effective, but too few pregnant women have it who are also HIV positive. And that gravitated to trying to help people build health systems. We were being wildly successful in Ethiopia, for example, except where we weren't. Because Ethiopia was a country with more than 80 million people, now has about 90, I think. When we started, there were about 84 million people there. 60% of the people lived in villages of fewer than 1,000 people. If you were one of the 40% that lived in a city, you'd be fine. If you had the Ethiopian health minister come here to speak next year, you would say, if you're an American, I'd feel proud if that man were the Secretary of Health and Human Services in the United States. But if you lived out in the country, in more than 60,000 villages, there were 700 clinics. So you had all these people out there just dying anonymously. So I said, okay, what do you want us to do? And they said, well, if you get us 3,500 clinics, everybody will be within a day's walk of care. So we designed, they designed it. We worked with them, and we set about that. And I said, how many do we have to do to get everybody within 3 or 4 hours walk? He said 16,000. But still, out of 60,000 villages, these are very simple, rudimentary things with a little bit of refrigeration capacity, sanitation away from the examination rooms, just basic stuff. But the point is, we got into this system building. And then the Rwandans, who had lost all their hospitals except for the one in the capital, Kigali, asked me and Partners in Health, a lot of you know that NGO, to build hospitals in every region of the country that didn't have one. There were 8, we did it. And then they asked, including, by the way, a cancer hospital in Butaro near the Ugandan border. It's the best cancer treatment center in Central Africa. And a lot of people think that everybody in poor countries dies of AIDS, TB, malaria, or infections related to dirty water, but the cancer rates are about what they are in the developed world. So they thanked us, and then they asked us if we would work in 2 of their districts to do the model that Paul Farmer had perfected in Haiti, where a professional staff that you would think could treat 20,000 people serves a catchment area of 200,000 because of a networks of clinics and community health workers. So we did 2 of the districts. And they said, okay, stop. I love this. They said, now we have to figure out how to do it for ourselves. But we want you to help us train the entire workforce. And there wasn't a lot of money for it. And one of the things that I really hate about foreign assistance generally is that in the United States and most other rich countries, at least 35% of the money that you, if you're an American, pay for foreign assistance is claimed by American non-governmental organizations before it ever gets to the people it's supposed to help. Normally, 15% administrative overhead just for American operations, then another 20% in country. And I hate that. I don't take any American government money. It wouldn't look too good with Hillary being Secretary of State. But I didn't take any money from the Bush administration. And when she's gone, I won't take any from the Obama administration. I just tried to reform foreign aid. So we got, it's amazing, 13 American medical education institutions to agree to work in in Rwanda for a minimum of 2 years for 7% overhead. Nothing, I think they're going to lose money. I don't, but they also felt this. They felt that it was wrong. And so PEPFAR gave us $20 million this year, and they said, we'll give you $13 million the second and the third and the fourth year. You got to raise the rest. So it's one of the things I got to do. But the point is, these people are there, and they are training a Rwandan health force to be self-sufficient. So we are marrying modern technology and knowledge. Now, if you look at America, what we have to do is to use technology and science to deal with the patient outcome problem. If you look at the differences in our outcomes and others, from a cost point of view, pure economics, it's in financing the way we price healthcare, the way we live, and in healthcare delivery, including mostly medical errors and all these things that all of you know more about than I do. So this is really important what you're doing here, because I think our future depends not only on the moral imperative of not having 200,000 people die a year who don't have to die, but on our ability to give the highest quality health care in the world at a more competitive price as a percentage of our income. And it cannot be done overnight, because a lot of this encrusted layering of things were good people piling one solution on top of another and rubbing up against one another. I understand that. But there's no question, just for example, we were talking about this backstage, that the wider adoption of fundamental checklists to prevent hospital deaths and other problems from infections will make a big difference. There's no question that Joe's long crusade to stop unnecessary blood transfusions and the infections that come out of not having good sanitary blood banks and sources will have a big impact. There's no question that if we all have a good interconnected medical records system that really works across time and space, it'll have a big impact. There's no question that if more and more employers will both try to help their employees become healthier and share the data, as I think GE and some other companies are doing, that data sharing will have a big impact. But when people recoil at making these changes, we need to tell them, hey, there's no devil here, but we've got an encrusted system that's killing people who ought to be living, not because there's somebody lurking behind the shadows, but because we have not made a process of continuous improvement that requires these institutions to be totally reforming. And when you think about it and what you do, I'm telling you, we have to do the same thing in economics, we have to do the same thing in energy, we have to do the same thing across with the federal budget, we have to do the same thing across the whole wide spectrum of American life. And other wealthy countries do too. And we have to figure out, among other things, how we're going to do it together. So let me go back just a minute to what I do. We started working on childhood obesity because we'd gotten this cooperation. I got all these activists together and I said, you know, isn't it true that half these kids who are overweight get 50 to 60% of their calories a day just from the drinks they consume in schools? They said, yeah. And I said, I think we can make a deal with the soft drink industry to stop that. Take the full sugar drinks and even the fruit juice drinks in their the larger portions out and do other things. And they looked at me like I had become old, senile, was on the verge of dementia, and needed to be locked away as soon as possible. That may be right, but not for this reason. But anyway, before you know it, we had Coke, PepsiCo, Cadbury, Schweppes, the other big providers of drinks. They agreed that they would work together to do this, and it took them 4 years, but there has been a 90% reduction in the total caloric content of drinks served to kids in schools through vending machines and cafeterias because they agreed. And I made a simple argument. I said, I don't think you're trying to kill these kids, are you? I'm not like all these people who are calling you names. I don't think you ever intended this. It's just happened. I said, I'm well aware that a lot of PTAs in schools make all the money they make to operate every year from the payments you make off the vending machines to them. And I don't think you were deliberately setting out to hurt these kids. I said, neither do I think you want them to be 35 sitting in a wheelchair with an amputated leg instead of being healthy, income-earning people who can buy your soft drinks. Now, this won't work unless you do it together. The same way with the AIDS drugs providers. I said, unless you do this together, it won't work. But we've got to find a non-zero-sum solution here. We've got to find a solution where everybody can win. I tried the same thing with the snack providers, and we only got about a 30% reduction there, but that's something. But the reason there is the market's much more diffuse among the owners, the participants. We have 30 million kids now on meal plans that are much more nutritious, and we did it all before the new government standards came out by creating networks. That's why I have such hope for this network. And now, as a result of the reason I'm here today is I'm on my way down to Palm Springs to the golf tournament that I sponsor with Humana every year. That used to be called the Bob Hope Golf Tournament, and it was about to fail, and I agreed to do it, but only if they would let me try to make health and wellness the focus of the beginning of the tournament. Bob Hope lived to be 100 because he walked an hour every day of his life, no matter how bad the weather was. Very interesting. So they did, and out of that, we formed a whole new group for the non-children who need lifestyle help. It's called Health Matters, and we're having a meeting, and there's going to be about 30 very specific commitments made there to do things that will begin to change. We now have pretty good data that childhood obesity has leveled off in America and has begun to go down, not nearly as fast as it should. But the point I want to make is that I'm trying to encourage those of you who are here at this first meeting. You have much more resources in your brains and access than I did when we started this childhood obesity thing. You know 100 times more about what you're doing than I did when I waded into this thicket. And the point I want to make to you is, if you will keep together as a network, you can change the world. And if you do it right, you will, without even trying, also put a brake on medical inflation, increase the quality of care, enhance wellness, and help us to become more competitive in the 21st century world before we pay a terrible price. About 10 days before the election last November, when nobody was paying any attention to these things, because it was all politics all the time, there was this huge story in USA Today by an economist who'd done a long analysis saying, well, there were two reasons that middle-class incomes were lower than they were the day I left office. Median family income was lower than they were the day I left office before the election. And they were lower before the financial crash. They said, you know, One was we weren't creating enough jobs and we didn't have enough tightness in the labor market and profits were down. But the other was that employers who wished to give their workers a pay raise spent all the money on health care premiums for a system not engaged in continuous reform, improvement, and quality outcomes. So I know what I said to those soft drink manufacturers is true of you. I know that none of you want to be part of a system that leaves us sicker and broke, or you wouldn't be here. I know that just from what I've already seen, the promise of science and technology is important, but we have to develop the right mindset. One that says we have to work together, one that says we need networks, one that says we got to share data, not hoard it. One that commits to a process of continuous improvement, and one that is patient. Because we're not going to turn this around overnight. It took us 4 years to get a 90% reduction in calories and drinks in the schools. 4 years well spent. It may take you 4 or 5 years before you can see dramatic drops in that number, but it is not unrealistic to think that by 2020, which I think is your goal, you can get rid of unnecessary deaths in the American healthcare system. It is not unrealistic, because what happens is, based on my experience in other areas, you start slow and then it starts snowballing. Because once people can see something happening that has a face and a name and a story and a family and an employer and a community life to it, then all the resistance begins to tumble. So I will say again, I think the future belongs to creative networks of cooperation. And I think in order for the builders to beat the breakers in the 21st century in every area, that's what we have to do. And we simply can no longer think that the only way we can succeed, personally, professionally, economically, you name it, is if someone else fails. In an interdependent world, our success depends upon guaranteeing a certain chance for success in healthcare and education and economics to everyone else. And it depends upon our believing that our differences are important, they make life more interesting. That's why networks work. If there were no difference, then you could just pick the smartest person in the room, lock them in a closet, tell them to come up with a solution, and the rest of us would salute. Right? But we know nobody's right all the time. And we know that there have actually been a lot of studies on this, that if you get a good network of cooperative people of average intelligence and assign them to any problem over a period of years, they will outperform one genius acting alone. There's lots of research on this. So if you get a network which includes a lot of geniuses, which this room would qualify, you'll do even better. So I look forward to next year. I urge you to keep this 2020 goal. And I urge you to try to share with people wherever you live who may be more resistant the idea that the only way wealthy societies, well-developed societies, can triumph in the 21st century is to be engaged in continuously reforming all their institutions. They all brought us to this dance today, but we won't be dancing a decade from now unless we learn to play better music. I'm actually quite optimistic. I'm not a gloom and doom person, but when you see the kinds of things that have happened against all the odds that are positive, it is impossible not to be optimistic. I just don't want you to underestimate the enormous power that you have in your brains, in your numbers, in your passion, and in your contacts. because there's a lot riding on it. Yes, the lives, and the lives of all the people who love them, and the lives of the communities where they live. But the very lifeblood of this country depends upon us unpacking a lot of these healthcare riddles. And you can pass all the laws you want, but how you implement them and how they interface with your potential to change will tell the tale. Thank you very much. Thank you. I had a whole section I was going to talk about that I didn't because I didn't know whether Joe had announced it or not. So I said, you announced these awards? He said, no, this afternoon. But let me say something else. I think this coalition of people, of which he's a big part, who are giving these real awards to healthcare providers all across the world, that's a very big deal too. Because these awards, and every year at the Global Initiative, I try to recognize leaders of non-governmental organizations in very poor places. And this is what I think the Nobel Prize should always be used for. Not in science and economics, but the Peace Prize. It's to inspire other people. So in advance of the honorees and the announcement, I just want to thank you for that too. These awards are really important. And I promise you, if you keep doing this for a decade and he keeps announcing the award winners here every year, that alone will make a huge difference. Thank you.
So at this time, I'd like to introduce the men and women of the companies who have made the pledge to make the data that their products are purchased for, whether it's displayed in a patient monitor or an infusion pump, or whether it's part of an electronic medical record, they've made the pledge to selflessly make that data the patient's data for the benefit of the patient data. So someday, if not one of us in here, maybe some 20-something-year-old kid can come up with an algorithm, a way to connect the care provider, the family, and the patient to that data that tells them something bad is about to occur. So I'm so proud to announce these people. I'm going to ask them to please step up and join us at the beginning of the couch. And President Clinton is going to come and thank you, and we're going to take a quick photo with you. And then afterwards, when I leave with the president, I'll come back briefly. Peter Pronovost is going to talk a little bit more about that with you. So first, I'm going to ask Dr. Peter Pronovost to join us here, please. Dr. Pronovost has been my clinical partner in trying to set up this movement so that we have 0 patient death. Checklist, and he's the one who created the checklist. Yes, yes.
Great speech.
May I have Marcela Lamego from Cercacor please join us? May I have Paul Gorup, who's the founder of Cerner, please join us? May I have Mr. Thierry Leclerc, who's the Vice President and General Manager of General Electric, please join us? May I have Ms. Marta Sewell from Smith Medical, who's Vice President of Clinical Marketing and Scientific Affairs, please join us? May I have Dr. Diku Mandavia, who's the Senior Vice President and Chief Medical Officer of Sonosite Fuji, please join us? May I have Mr. Brian Stewart, who's CEO of SurgiCount, please join us? And last but not least, may I have Mr. Rick Packer, who is CEO of Zoll Medical, please join us. Thank you. Thank you. Thank you. Thank you.
Thank you very much.
Thank you so much. We started a revolution here, gentlemen. Thank you. Thank you so much. Thank you so much. Thank you. Thank you very much. Thank you. Thank you, Paul. Thank you so much. Thank you, Marcelo. Thank you. Well, President Clinton has to go to his own conference, so thank you so much, Mr. President. Thank you. Thank you so much.